Today, we're talking about how to dress pressure injuries using basic wound care supplies. No need for fancy products. By the end of this video, you'll know how to choose a dressing that fits the wound's needs and helps create the right environment for healing. We often think dressing choice is what heals the wound, but here's the thing. It's not the dressing that heals the wound. It's how we use that dressing to protect the wound and support the body's natural process. Let's break that down together. For those who don't know me, my name is Dr. Voltaire, a wound care physician. I've seen wounds stall because the wrong dressing was used or because the dressing wasn't matched to what the wound actually needed that day. My goal today is to help you feel confident, keeping it simple but effective. If you've ever felt overwhelmed by dressing choices, or if you're new to wound care and wondering where to start, this is for you. You don't need fancy tools. You just need to understand the basics and apply them with care. Here's what we'll cover today: how to assess the wound so your dressing matches what it needs, what the main dressing types do, and when to use them, common mistakes I see in practice that slow healing, and I'll share a real case where basic supplies helped a wound heal better than expensive options. And at the end, I'll tell you the #1 mistake I see with pressure injury dressings and how to avoid it. Let's start at the beginning. A dressing's job is simple: protect the wound, manage moisture, create a safe environment for healing. But if the dressing is wrong for the wound stage or drainage, or if it's applied the wrong way, it can actually hold healing back. It can cause maceration, it can trap slough, it can damage surrounding skin. Therefore, our goal is to match the dressing to what the wound needs today, not what it needed last week or what a product ad tells us to use. You might hear the term Deamapy. That's a lot of letters, but the idea is simple. This acronym was developed by professionals in the field of wound care at the Emory University School of Medicine. So it means debride what you can safely, so get rid of dead tissue. Identify infection early. Wick up dead space, so fill gently in, but don't pack tight. Absorb extra moisture. Maintain moisture, but not too wet and not too dry. Open edges so they can migrate in. Protect and insulate the wound, and importantly, document so the next person knows what's happening. To clean the wound, you use normal saline or clean water. That's often all that you need. You apply gentle pressure, enough to clean, but not enough to harm the new tissue. If it bleeds a little, often that's okay. Sometimes it means the tissue is viable. After cleaning, you pat the area dry around the wound. And then ask yourself, did I clear away loose debris? Is the peri-wound skin protected? Do I see slough or eschar that needs further debridement? Let's walk through what's available and when to use it. Moist gauze can keep the wound moist and lightly fills in the space. It's good for shallow wounds with minimal drainage. Packing gauze is good for deeper wounds or tunneling wounds. Always leave a tail and document how much you used. ABD pads are very good at absorbing excess drainage. Transparent films are good for stage 1 or shallow stage 2 injuries. They can also help protect intact blisters. Foam dressings are good because they are pretty absorbent and they add cushioning. They also can protect fragile skin. Hydrocolloid and hydrogels hold moisture in, and they're good for drier wounds, not for heavy drainage. Silicone dressings are very gentle on the skin, and they help with absorption without causing damage. Hydrofiber, with or without silver, can absorb a lot of fluid, and silver alone can help if infection is a concern. And if you're using tape, paper or silicone tape is the kindest to fragile skin. Here's what I see all too often: packing too tightly, which stops the wound from contracting. Leaving dressings wet too long. It causes maceration. Picking dressings based on brand and not the wound's needs. And forgetting to protect the surrounding skin. Pause here. Have you ever seen these happen? What would you do differently? Let me share a case. I had a patient, let's call Mr. J, who developed a sacral pressure injury after a long hospital stay. His family was stressed, thinking they needed to order expensive dressings online. But here's what we did. Cleaned the wound with saline, filled lightly with moist gauze, not tight packing, covered with foam, protected surrounding skin with a barrier cream, and repositioned him regularly and optimized his nutrition. And guess what? That wound healed because we matched the care to the wound, not the product to the budget. Have you ever stood there, dressing in hand, and thought, I hope this is the right choice? You're not alone. The wound will tell you what it needs. You just have to pause and listen. We started by saying the dressing doesn't heal the wound, the environment does. When we choose wisely, clean gently, and protect the skin, we give the body what it needs to do its job. That's the heart of good wound care. Thanks for watching. If you like this video, check out my next one on how to spot and prevent dressing-related skin injuries, something we don't talk about enough. Stay informed and heal well.